this is a research project that I've been doing with my colleagues at the University of Edinburgh, where we wanted to understand a bit more about how diabetes was discussed on Twitter. So I'm just going to do a very quick introduction. I'm sure most people sort of are aware of this anyway, but we've got two parallel trends that exist in society at the moment. One of them is around internet penetration, and that's obviously on the increase. And I think the latest figures I saw were 500 million tweets a day, although I'm sure that has increased over the course of the past few days with this conference. So the other thing that is also in the increase is the number of patients suffering from diagnosed with diabetes and having to manage that on a worldwide basis. So the latest figures from the International Diabetes Federation is that actually by 2035, 592 million people will be diagnosed with diabetes. So when you consider those two sort of trends, it's quite an interesting topic in terms of the research potential associated with Twitter and other social media sites for the purposes of public health research. So over recent years, there's been a lot of research into this area. They tend to fall into four buckets. So there's obviously positioning and opinion papers that exist. These talk about the benefits, the challenges, the opportunity associated with social media, particularly in relation to diabetes and other conditions. There's the systematic and scoping reviews that exist. So last year and also early this year, there's been a few studies that have been published that relate to using social media for public health research and practice, healthcare communication, and also understanding how people use social media. So that's talking about patients, HCPs, caregivers, etc. So there's also the observational studies bucket. So these tend to come from the population health sciences space, the behavioral science space, psychology, trying to understand what people use social media, Twitter for. And I think also the epidemiological space where you've got the, for example, H1N1, swine flu, they're using a lot of Twitter data to track infectious diseases through a population. But there's also, obviously, that's been extended to include things like cancer, so breast cancer is quite a hot topic. I'm interested to hear your talk after this. But also other health-related topics, things like, obviously diabetes is one, but things like people's perception of antibiotics, vaccines, cardiac arrest, suicide risk using Twitter data. Then there's the final bucket, which is around experimental studies. So these tend to come from the computer science and informatics research space. So they've used public health topics to sort of test some of their algorithms and techniques around data mining, content analysis, and a number of other things. So this study that we conducted actually fits into the observational study piece. And I'm now going to go into sort of a bit more detail around that. So we wanted to understand not just about the number of tweets that people were using to talk about diabetes, but also what actual topics were they discussing, what were the intentions behind the messages that were being posted. So we had a number of hypotheses that we wanted to test. One of them was around the dissemination of information. So were people using Twitter to share information about diabetes, or were they using it to seek information about diabetes? We also had a interest in trying to understand actually what type of diabetes is the most prevalent within the Twitter space. And we guessed initially that it was going to be type 2, and we wanted to test whether that was going to be correct or not. So the third hypothesis that we tested was around the cause and prevention of diabetes as a topic that's discussed within Twitter. So is it related to the cause and prevention, or is it related to more the management and the treatment of the condition? And so we wanted to understand a little bit more about that. And actually, is the information on Twitter relevant to patients, or is it relevant to other stakeholder groups within the healthcare environment that are interested or associated with the condition of diabetes? So we applied a three-stage approach. We first obviously extracted the data, but then after we'd extracted the data, we used the four-phase Prisma approach to sort of select and screen the data for relevance, basically, so that when we had our final sample, that we could then go through it and use that as the basis for qualitative analysis. Now, we developed a classification structure that I'll share with you in a minute, but we used that to basically code each of the tweets that we had within our sample. We then went through a bit of a statistical analysis of the qualitative results. Now, that was broken down into two parts, the descriptive statistics, but also trying to get meaning out of the data itself. So we did a cluster analysis technique. So for the geeks amongst us, this is a bit of a summary of the data that we used. So we had a 1% sample, so the fact that you have access to a much wider sample is great news for us. And we looked at a very short time period. So we were looking at the September 2013. We extracted all tweets that had made reference to diabetes. So we had initially a sample of over 3,000. But once you remove non-English tweets and spam, because there's quite a bit of that as well, we ended up with about 2,800 tweets. Now, we then had to screen it to say, actually, is this relevant to the condition and health, or is it just, like you mentioned before, is it a joke? Is it, just a synonym for diabetes being used as a synonym for sweet? And so we ended up with a final sample of 1,925 tweets, which we used as the qualitative analysis. So, non-health related tweets. Now, what do these look like? So, I'm pretty sure we can all agree, found a jelly bean in my Skittles like a surprise gift from the diabetes fairy, is not really relevant to the clinical condition. Okay? So once we'd filtered those out, we then obviously had health-related tweets. Now, these are ones that are much more relevant to individuals, people who either are suffering from the condition themselves or have family members that do, or are involved in the treatment of the condition. There's advice in terms of how to manage your risk. Is it related to diet, exercise, for example? And also there was things around the fundraising associated with diabetes research. So we classified those as all health-related. So when we then went into the qualitative analysis phase, we iteratively developed a classification structure that of codes that we applied to to the sample. So this classification structure covered a number of things. So we looked at the tweet content itself. So was it related to the cause and prevention? Was it related to diagnosis and treatment management? I have to say, although we got it down to 6 codes now, originally it was over 20. We had things like, was it related to diet? Was it related to exercise? Did it refer to insulin? Did it, was it blood glucose level, for example? And then we also included what type of diabetes it was. So type 1, type 2, gestational. We also included pre-diabetes, although I know there's a bit of controversy as to whether that's actually a term that's valid. But we wanted to see actually whether it was referred to in the data. We then looked at the stakeholder group for which the tweet was relevant for. So was it relevant for a patient? Was it relevant for a provider? Was it relevant to a regulator or a payer or a charity or any news channel that was posting the information? And then we looked at the intention behind the tweet. So we used Bayes' interaction process analysis technique. We based it on that. And we defined 6 codes. So things like, was it information seeking, information giving, opinion given, opinion seeking, etc. And we also included the characteristic of the tweet itself. So was it a retweet, which is what we meant by duplicate, and also who posted it? Was it posted by an organization or community? So here's some of the results from this study. So if we go back to the 4 hypotheses that we were trying to test. So is Twitter used to seek and share information about diabetes with other users? We can say that yes, it is, based on the sample that we have. So information giving. But in terms of information seeking, 2.5% of the sample. So that's significantly lower than actually the information giving, which suggests more of a push for information rather than a pull. From a type 2 diabetes perspective, that was the most prominent that was discussed in the sample. The next one was type 1, which was about 6% of the sample, and gestational, which was just over 1%. The third hypothesis actually was proved to be invalid, because actually the biggest percentage of the tweets was actually related to the diagnosis, treatment, and management of the condition. And then the fourth hypothesis, which was around patients being the dominating group that the content was relevant for, was actually 16.5%. So that was the descriptive statistics that we conducted. We now went into the more sophisticated stuff, the hierarchical cluster analysis that we conducted. Now, can I just ask, has anybody seen one of these graphs before? Okay, good. So it's a dendrogram. But just to sort of give people who haven't seen one of these before, it's a way of grouping data points, so the tweets, together in terms of similarity. So are they correlated with each other? So you can get some more meaning from the data itself. So I won't go through all of this in detail, but I wanted to pull out a couple of things. So charity and support seeking. So these are support seeking tweets that are relevant for a charity, are highly correlated, which I guess if you think about it from a logical perspective, that makes sense, because a lot of the support seeking that you see is related to fundraising, emotional support for people who are about to embark on a marathon, for example, that sort of thing. The other thing that I wanted to draw out was the diagnosis, treatment, and management, and its correlation with the news, and also the company and brand and regulator. So if the tweet referred to a company or brand, it was highly correlated with regulators, being relevant for regulators, which kind of makes sense, because actually, most people don't refer to what product they're using or what treatment they're using. But what people do refer to is if a treatment has been approved or has been removed from the market by a regulator. Okay. Okay, so, I mean, there's a couple of other things. I'm conscious of time. But, so cause and prevention was highly correlated with type 2 diabetes, which is also an interesting one as well, because actually, I think because of the nature of the condition, type 2 diabetes condition, there's a lot of advice out there in terms of how do you reduce the risk of getting it, and it's all related to diet and exercise, etc. So in conclusion, Twitter is a valid source of data for public health research, as 60% of the tweets that were included in the sample were actually relevant to the clinical condition. However, it really very much depends on what you're trying to study, and what you're trying to find. So if you are trying to get patient-specific insight, you may not want to use Twitter to do that, because a number of reasons that I've listed here. There's much more push rather than pull for information. There's a high correlation between diagnosis, treatment, management, and media news stories. And also the fact that actually 1 in 5 tweets is posted by an organizational community, not by a patient. So these are things that are worth considering. So that leaves me to say thank you. And I've got time for questions. Good.
Absolutely.